Welcome to today's Marketplace. I'm Elizabeth Hart at the NASDAQ. Today we're joined by CEO of NeuroOne, Dave Rosa, and Dr. Jessica Clark, Dean of the College of Nursing at Creighton University. Such an honor to have you both here with us today. Welcome.
Thank you.
Thanks.
Okay, so Jessica, today we're going to be talking about epilepsy and treatments, and I'm very interested in this because it runs in my family. So what's out there? What's happening right now? And how many people are diagnosed with epilepsy every year?
Sure. So epilepsy is actually a neurological condition.
Right.
And what we know right now is that within, worldwide spread, we're looking at about 50 million impacted.
Wow.
And epilepsy, as you know, can affect anyone at any time. And typically we see diagnosis after 2 active seizures. And in the US today, we have over 3 million people actively with the process.
So it's been around for a long time. And back in the day, the only real treatment for it was actually adjusting the diet to reduce the amount of carbs that you took in. But now we have a lot of other options. What's the standard of care?
Yeah, so I would say most patients are able to manage their symptoms and the disease with pharmaceuticals. However, we know about a third of patients actually don't react to medication regimens or pharmaceuticals. So that really leaves over 1 million people that are looking for other advanced medical treatments aside from drug management.
That's too many people.
It is.
Dave, I understand that NeuroOne has FDA 510K clearance on some products. So what are those products and what does the 510K clearance do for you?
Sure. So NeuroOne has clearance on the 1RF ablation system. So it's a system that has 3 main components. Going to have to find it. It's so small in my pocket here. Look at that.
Tiny.
So this device is probably the brains of the system. It's an electrode, and what this does is it records brain activity, monitors the activity, but then also performs the ablation through these tiny contacts that are very difficult to see. So this is actually what goes into the brain of the patient. In addition to that, we also have a temperature probe, which actually is placed in the center of that electrode. And that just ensures that the temperature doesn't become too hot in the brain to prevent charring of brain tissue. And then the third component would be the generator, and the generator is what transfers the heat from a piece of capital equipment to the electrode that I showed.
And that temperature control was a key piece for NeuroOne. It was something that other companies were attempting to get on top of, but they just couldn't do it.
Yeah, that's correct. There were a number of companies that attempted to incorporate temperature control into the system. And I really believe that the FDA cleared the system as quickly as they did, which was 5 months, because we are able to actually monitor the real-time temperature in the brain during the ablation of the brain tissue.
And controlling that heat was a key piece of coming up with this product that can be used in real life, because that's something that other companies have attempted and haven't been able to accomplish.
Yeah, there's been a number of attempts actually to do this unsuccessfully so far, but I really think that the temperature control was a key reason why the FDA provided a clearance, and it occurred in 5 months, which is pretty fast.
Yeah.
For FDA.
Well, there's a need for it, so it's a good thing that they pushed it through. So I understand that you have sort of a unique approach to this. The surgery is performed and then the electrodes are actually left in the brain. What does that do for the doctor? How does it help them gain confidence that the procedure worked?
Sure. This system really has what I think are 2 key components to it. First is before any neurosurgeon is going to remove or destroy brain tissue, because that can be fairly intimidating, they want to make sure they can pinpoint the area of the tissue that's actually triggering that. So they use the technology it's typically a week where the electrodes will be in the brain while the patient's in their room being monitored. And then after the ablation is done, really what the purpose of the electrode is to ensure that the brain activity is back to normal. Because if there remains some residual activity, which would signify that maybe this patient still would continue to have seizures, the neurosurgeon would be able to touch up that area to ensure it's back to normal activity.
And so you don't just send the patient home after this procedure, they actually stay in the hospital and they're monitored with those electrodes. So it allows you to address any issues almost immediately.
That's the idea, for
Okay.
sure.
So are there multiple procedures involved in this, or is this a one-time deal?
Yeah, so this is also one of the key concepts really with our technology. And it was, can we, through one hospitalization and one procedure, treat this condition? Prior to our technology being available, what a patient would have to endure is they would come in for the normal surgical procedure where the electrodes were placed. And then after the neurosurgeon and neurologist were confident that they identified the right location, they would remove all the devices, send the patient home, and then schedule a surgery using a different type of technology that would require the patient to come back again, go into the operating room, have these invasive devices placed again, and then the tissue would be removed through burning it, much like we do. And then the patient would be sent home without the ability to really monitor what's happening in there. So what we do differently is when you come in and the electrodes are placed, you go to your room much like you would with the normal approach. And then after the ablation is done using the same devices, you're there for typically 24 hours to monitor it. And then, like you said earlier, if the activity is back to normal, then the patient is sent home. So you come in one time, you get the diagnostic and the therapeutic procedure done through one placement. And one of the things that's actually also nice is the ablation itself is performed by the patient's bedside. There's no need for that patient to go back into the operating room.
Okay, so you're seeing some great results. You have a lot of success stories. One young woman who was a teenager has just had a complete turnaround on her life.
Yeah. So that's Clara. I'm getting goosebumps now thinking about her, but she was a young lady that was experiencing every evening 10 seizures.
Oh my goodness.
And this went on for a couple of years. They were unable to treat her successfully using medications. In fact, she eventually got referred to the Mayo Clinic in Jacksonville, Florida, and they felt that it would be a good test for our technology. We performed a number of ablations in the brain. She has not had a seizure. I think it's now close to 9 months. She had to quit school, wasn't able to attend college prior to the procedure being done. She just told us that she's enrolled in college and her life is back to normal.
Oh, well, congratulations. That's a wonderful story. And thanks so much for everything you're doing to make things like that happen. Jessica, from a healthcare facility and clinical perspective, how many hospitals right now offer this type of treatment?
Yeah, so about 200 right now, but you can imagine with this kind of technology that's emerging, patients and consumers, right, they want better therapies, more treatment. And so I only look for it to grow. Again, as you heard Dave speak, patients are really impacted by epilepsy because of the number of seizures, and it really affects their daily activities, their quality of life. So we're really excited to see how this technology expands.
Okay, well, I love this for myself and my family and everybody else that's affected by this. Dave, what do you think the future looks like?
Well, I think this technology is really a platform that can be used for a variety of different areas. One is stimulation for management of pain. The second is drug delivery. So using that same electrode that's used for monitoring, recording, and ablation, the center of that device is hollow, and you can attach actually tubing connected to a syringe, connected to a drug pump, and you can actually infuse gene therapies, cell-based therapies that are going to be the future, I think, in the management of some of these neurological conditions. And then using that same device, you can, again, monitor the effectiveness of the device by monitoring the brain activity.
Okay, well, I know from my own personal connection to epilepsy that it's important for patients to keep up with these emerging technologies. There may be a much better solution out there for them than they currently have access to. So thank you so much for your time and for the great work that you're doing. Thank you.
Thank you.